Mr. Jones. How are you?
Glad to know you.
Thank you for coming in to visit us today. Is this the first time you've come into our practice?
Yes, it is.
Okay. My name is Debbie Massaro. I'm the DNP candidate from Radford University, and I'm just going to be conducting your interview today. So if it's okay with you, we'll go ahead and get started.
Fine, let's go.
Okay. What brings you in here today?
I've had back pain for a long time.
Okay. Low back pain, mid, upper?
Low back pain in the lumbosacral area.
Okay, lumbosacral? Lumbar sacral, okay. When did this pain initially begin? Go back as far back as you can remember?
It actually started about 1997.
Mm-hmm.
When I first moved up to this area.
Here to southwestern Virginia?
Yes.
Okay. Where did you move from?
Moved from Florida.
Wow, that's quite a change. Okay. So you say it started when you moved up here. What did you begin noticing?
Well, I was doing a lot of remodeling and reconstruction work on our house, and began to notice pain in my lower back extending down to my legs, which wasn't responding to any kind of over-the-counter medication.
Okay, when you speak about this pain, was it a constant pain, or did it come on intermittently, or how would you?
It was there most of the time. It was aggravated when I would do exertive work like lifting something, climbing upstairs, or.
Okay, and I see you're 76 years old.
That's right.
And they have not done any lab work on you yet or taken your vital signs, so we'll be sure and get those today. And I'll probably do a workup on you after we finish the interview. All right, well that sounds like it was quite uncomfortable. What type of pain, how would you describe that pain that you begin to have in your legs?
Well, actually, the pain starts in my lower back
Okay.
when I start to walk, or if I'm sitting for a long period of time.
Mm-hmm.
And then I start getting pain on walking. It's now very short distances that I can walk without pain in my
okay.
legs and stopping.
So back in 1997,
That was just back pain, but now it's completely in my legs.
now it's continuing on and including the back of your legs, or
My whole
the
legs.
whole leg? Okay. Were you exercising at all back in the late 1990s? Were you doing any regular exercises?
No, I
or
wasn't.
anything? But did you
No.
work outside?
I was
you
working,
say you were working on
doing
your
a lot of work in
home?
restoring an old house, and involved climbing up ladders and building
Okay.
scaffolding. So
Well, it sounds like you were pretty well active
I
at
was
that time.
pretty active at that time.
Okay, all right. So that was about 16 years ago.
15 or 16 years ago, yeah.
Okay. And so, did you visit a doctor at that time?
I think I went to our local family practitioner at the time.
Mm-hmm. And what was the diagnosis?
It's chronic low back pain, degenerative arthritis.
Mm-hmm. Okay. And what treatment or procedures did you receive for this pain and the complaint?
I think I was put on, if I remember correctly, physical therapy for about 4 weeks, and continue over-the-counter medication.
Mm-hmm.
Maybe apply some heat too. I think it was about.
Diagnostic-wise?
I had a routine X-ray of the lower back.
Okay, I'm going to have to have the nurse get a copy of that for us. Over-the-counter meds, physical therapy for how long?
4 weeks.
Okay, and an X-ray. All right.
X-ray.
Okay. Do you remember what the interpretation of the X-ray was?
Chronic degenerative changes.
Okay.
There's
All right.
no evidence of any disc rupture.
No disc rupture. Okay. All right. So as things progressed over the next 15 or 16 years or so, did you go back and return? Did the Did the pain recede some with the physical therapy? Did that seem
It
to help?
did a little bit, but then it would come off and on, and during that time I was referred to various orthopedic evaluations.
Okay. First the family practice, and then the orthopedic.
Right.
And what did the orthopedic doctor have for you, treatment-wise?
Basically the same diagnosis, just degenerative arthritis, and put me on the same regimen.
That must. How was that for you? Did that sit well with you to just continue the same treatment?
Hoping that
were you okay
there
with
was
that?
something there that we could treat, but
Okay.
unfortunately there was no diagnostic problem that they could identify other than arthritis. So.
Did they do, over this past 15, 16 years, have you had any additional x-rays?
I've had 3 MRIs.
Oh, okay.
One in 2003, one in 2007, and one in 2011.
Okay. And what were the results of those?
Well, it showed the same
MRIs?
thing, just degenerative changes, and the first one showed a suggestion of a spinal stenosis.
Okay.
And then the second one said the same thing, and the last one did show a significant critical stenosis at L5.
This
L4,
2007 one?
That 2011.
2011, excuse me, I'm
At
sorry.
L4, L5.
Any disc herniation?
No.
Okay. And so did you approach or want any treatment for that as far as
Well,
aggressive nature?
Yes, I was given an epidural injection, steroid epidural.
Okay.
It helped a little bit. But,
With an orthopedic
yes,
doctor?
the
Okay.
orthopedic back doctor.
How many epidurals have you had?
I only had one before that. And,
Before
this one. And
in
it was-
2011?
Yeah.
How many
About-
years ago was
About
it?
the same, it was about 5 years ago.
The first one,
Mhm.
okay. So you received minimal or significant relief for those 2 epidurals, from the
Minimal.
2. Okay, minimal. And then how would you describe your activity level during that period of time when you've been receiving
Well,
the
it's
epidurals?
progressed from
Improving or?
Well, it's progressed from just pain and slight problem with walking to the point now that it's very difficult to walk and constant pain. And even at night, I get cramps in my legs.
Would you say that's becoming more and more frequent?
Yes, very much so.
Is it keeping you from sleeping?
Yes, at times it does, yes.
That must be concerning to you and your family.
Yes, especially since I have obstructive apnea and I have to sleep with a mask.
Oh, okay, so you have chronic obstructive apnea?
Yes.
And what about how would you describe your activity level changing over these last 10, 15 years from when you were up in ladders, you say, working on your house?
I can still
How's
go
that?
up ladders, and I limit myself now because I know what's going to happen. After I do a lot of work, it's going to be just more painful. So my activity is greatly diminished. I can't do any social activities such as walking to an affair or antique show or something like that. I can't walk on campus, visit with my children, or at least
They're in college?
yes, too. It's very painful to walk upstairs.
Do you find yourself modifying your activities because of this pain? Would
Yes.
you say
Yes.
greatly or little, minimal, or how much is it interfering with
yeah.
your
I don't stop.
activities of daily living? Is there anything you feel like you can't do?
Yes, I can't walk any distance.
Okay. Okay, so that's pretty well been curtailed.
Pretty much so, yes.
That must be very difficult for you.
It is. It's very problematic because I can't really do what I want to do.
Okay. How about over-the-counter medications, treatment, supplements? Do you take any over-the-counter? What are you taking?
For pain?
Well,
No.
altogether. Any
No,
herbal?
not really. I take some vitamins. I have prescription medications for other problems, but
Any complementary herbal supplements?
No.
Okay. And how do you manage your how are you managing your pain? What do you find yourself doing to
It's just,
control it?
it's mostly a mental outlook, is just that at some point I'm going to have surgery, and I keep putting it off. But I'm hoping that will help in resolve the situation.
Are you resting in bed more? Trying
Well,
to rest in
if
bed,
it gets
or-
really severe, I have to lay flat on my back.
More, are you resting more during the day, would you say?
Yes, I find myself having to lay on my back more times than I'd like to after doing some work.
What seems to relieve it the most?
I'm sorry?
What seems to relieve your symptoms once they come on with the
Lying completely
walking?
spine on my back.
Is it what type? How would you describe the pain that's in your legs at this time when the attack sort of comes
Well,
on? How would you describe that?
Pain starts in the lower back, then I start getting crampy pains in my legs.
Cramping?
And,
Any burning, searing?
No burning or searing, just a very bad muscle cramp, and then I stop walking, and leg pain stops. Still have back pain, but the leg pain stops.
Okay. Well, I'd like to go over this x-ray with you in just a few minutes, and I'd like to do a some neuro checks and neurological exam on you, and then we'll discuss a plan of action for you.
That seems fine. Thank you very much.
Okay. Very good. We're going to get this taken care of.
Thank you.
Okay. Thank you, sir.
Nice thing.
You too. All right. That was just like supposed to be for